Britain's rollout of the Pfizer-BioNTech vaccine continues, but advice on who can take it is changing. After 2 people with a history of severe allergies suffered reactions. Both recovered quickly, but the agency who approved the vaccine is making revisions.
Last evening, we were looking at 2 case reports of allergic reactions. We know from the very extensive clinical trials that this wasn't a feature, but if we need to strengthen our advice, now that we've had this experience in the vulnerable populations, the groups who've been selected as a priority, we get that advice to the field immediately.
Britain's mass vaccination programme already poses one of the biggest logistical challenges since World War II. But scientists warn that vaccines alone will not change the course of the pandemic immediately. And face masks, which help prevent the transmission of COVID, should be worn for another year.
I want to be very clear, for the next 3 months we will not have sufficient protection. We're going through the most difficult time of year for respiratory infections and the most difficult time of year for the NHS. So the idea we can suddenly stop now because the vaccine's here, that would be really premature.
Bleak news too in Germany, where infection rates continue to rise despite restrictions. And as intensive care wards reach capacity, many are calling for even tougher lockdown measures. Wednesday's German death toll of 590 was the highest since the pandemic began, sparking an impassioned plea from Chancellor Angela Merkel.
I want to say this, if we have too much contact over Christmas and afterwards, it turns out that that was the last Christmas with the grandparents, then we will have really messed up, and we should not mess up.
In France too, the numbers are not encouraging. New infections stand at around 13,000 per day, down dramatically on a month ago, but still 8,000 more than the target President Emmanuel Macron set in order to release the country from lockdown restrictions. Despite the vaccine's arrival, all 3 countries fear a third wave of coronavirus could hit when hospitals are at their most vulnerable. Charlie Angela, Al Jazeera.